Hello, my name is Dr. Dewan S. Raja. Today I will discuss about meta-analysis and systemic review. What is meta-analysis? A meta-analysis is a statistical technique used in research to combine and analyze the results from multiple independent studies on a particular topic or research question. By pooling data from multiple studies, meta-analysis can provide more precise estimates of the effects of an intervention, the strength of an association, or the magnitude of an effect size. So how about systemic review? A systemic review is a comprehensive and structural approach to summarizing evidence on a particular research question or topic. It involves systematically searching, selecting, critically appraising, and synthesizing relevant studies to provide a comprehensive overview of the existing evidence base. The process of meta-analysis: formulating a research question, literature search, selection criteria, data extraction, effect size calculation, weighting, meta-analysis. The effect size from individual studies are combined using statistical technique to generate an overall estimates of the effect size or effect magnitude, assessment for heterogeneity, publication bias assessment, interpretation and reporting through extensive statistics. So, meta-analysis uses statistics extensively, but systemic review may or may not use statistics, or if it uses statistics, maybe to the minimum or nominal level, not as extensive as that of the meta-analysis. Systemic reviews are considered one of the highest levels of evidence in evidence-based practice and research, as they provide rigorous and transparent synthesis of available evidence, helping to inform clinical practice, policy decision, and future research directions. Process of conducting a systemic review very similar to that of the meta-analysis, with little difference. Here we don't put emphasis on the statistics as we put too much emphasis on statistics in meta-analysis. Here again, the process: formulating the research question, developing inclusion and exclusion criteria. Suppose I will do a research on type 2 diabetes. I will avoid the literature on type 1 diabetes. The person's age should be above 40 in case of type 2 diabetic research. Person with or patient with age 15 or 20 will not be included in our systemic review for type 2 diabetes. In type 2 diabetes, will give more emphasis on the fasting blood sugar level, also hemoglobin A1C, serum triglyceride level, also the kidney function test. Okay, here study selection, data extraction, quality assessment, data synthesis, subgroup analysis and sensitivity analysis, interpretation and reporting following established reporting guideline such as PRISMA. What is PRISMA? Preferred reporting items for systemic reviews, and meta-analysis. So we'll use for systemic review PRIS part, PRIS type part of PRISMA. Okay, we got that. Systemic review versus meta-analysis. Meta-analysis and systemic review are both research methodologies used to synthesize evidence from multiple studies, but they differ in their objective, methods, and analysis. Meta-analysis focuses on quantitative synthesis and estimation of effect sizes. Primary focus of systemic review is on summarizing and synthesizing the evidence base as a whole, including both quantitative and qualitative findings in systemic review. To provide comprehensive overview in systemic review of the topic under investigation. In meta-analysis involves the use of statistical method to combine effect sizes from individual studies, often including calculations of summary effect sizes, confidence interval, and test for heterogeneity. Okay. So let us summarize differences between systemic review and meta-analysis. Systemic review is to produce hypothesis. It is a comprehensive study. It put emphasis on descriptive statistics, qualitative data, maybe also quantitative data, but not extensive statistics. Meta-analysis is to prove hypothesis statistically. Systemic review is a qualitative study with heterogeneous data, with some standard and acceptance exclusion inclusion process. Systemic review summarizes many literature in one comprehensive paper with good insight. Meta-analysis presents homogeneous data with extensive statistics. Meta-analysis involves statistical technique to pool and analyze data from individual studies, typically focusing on quantitative outcome measures such as effect size, risk ratio, or odd ratio, or all together. And that's all about systemic review and meta-analysis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.